Okay, I think we're good to go. Hello everyone, and welcome to another one of Wellspring's Be Well Talks. This is an informational webinar series that discusses a wide range of topics related to the experience of cancer. In today's talk, we will look at cellulitis infection prevention, what you need to know. My name is Shweta, and if you have any questions regarding the topic today, just please put it in your chat and we'll get back to it towards the end of the session. Next slide, please. Okay, so I'm very excited today to have Patricia Blinn on board with us today to deliver the webinar, and a little bit about her before we get started. So Patricia, Trish, Blinn is an occupational therapist at the Cancer Rehabilitation and Survivorship program at the Princess Margaret Cancer Center in Toronto. In this role, Trish works with an interdisciplinary team to provide support for outpatients experiencing cancer treatment-related side effects with the goal of improving function and quality of life. Trish recently completed a UHN collaborative academic practice CAP Quality Improvement Fellowship with a focus on cellulitis management in lymphedema. This 6-month fellowship provided support for Trish to lead a quality improvement project on cellulitis in her program aimed at increasing clinician confidence in cellulitis management. Trish is passionate about using clinical practice, education, research, and quality improvement initiatives to improve patient quality of life in individuals affected by cancer and to bridge gaps in oncology care. Thank you so much for being here with us, and over to you, Trish. I'll let you continue with your presentation, and we'll get back to any Q&A towards the end of this presentation. Thank you.
Thank you so much for the lovely introduction. It's definitely my pleasure to be here today, and thank you to all of you for spending your lunch hour with me. But here we go, a presentation on cellulitis, what you need to know. So it's already mentioned a little bit about where I work, but just a little bit more about my program for a bit of context. The Cancer Rehab and Survivorship program at Princess Margaret Cancer Center. We are a multidisciplinary team, and we're focused on treating the side effects of cancer treatment. So things like lymphedema, fatigue, brain fog, range of motion difficulties, emotional difficulties, all sorts of different things that can come up with cancer treatments. And we're really focused on self-management strategy coaching for these areas. And we treat any cancer type, any stage. In order to qualify for a program, you need to have had at least part of your treatment done at Princess Margaret. So that's just a little bit about where I work. Next, I want to mention why cellulitis. Why is this a topic that I've been doing a lot of talking about lately in the last few years? But basically, starting in around 2022, I was noticing colloquially in our clinic that there seemed to be more cellulitis cases that were coming up. And I soon discovered that this was corroborated by more international research showing that cellulitis seems to be on the rise. I noticed how much of an impact it had on patients' quality of life. So I was wondering how we can potentially treat or prevent cellulitis a little bit better. And there is a lot of great research showing that there is conservative strategies that you can implement now to make your risk of cellulitis less. So I thought that that was really exciting. And as was mentioned before, I did do a quality improvement project in my program aimed at improving our knowledge for cellulitis prevention and management. And since then, I've gone on to do quite a few staff trainings, but this is my first patient-facing presentation, so hopefully it goes okay. Although this is education I often give very often to my patients on a day-to-day basis in clinic as well. Oops. So here's where we're going today. I'm going to start off talking a bit about what is cellulitis, why there's this higher risk in lymphedema, signs and symptoms of cellulitis, most importantly, how to prevent it, what to do if you suspect that you have cellulitis, and considerations for recurrent cellulitis. So what is cellulitis? It is a bacterial infection of the skin and the tissues beneath the skin. And it's actually believed to be caused by bacteria that are often already living on the skin. And these are bacteria such as strep A, strep B, and staph. And if untreated, it can potentially be dangerous. There is a risk of it spreading to the blood, a risk of sepsis or of death in very, very rare scenarios, especially if people are reluctant to seek help for it. And just to note that it's sometimes referred to as erysipelas, so something to keep an eye out in your chart as well. And importantly, what is lymphedema? And just to preface, most of what I'm presenting to you today is specifically for preventing cellulitis if you have been diagnosed with lymphedema. Lymphedema is a chronic swelling that can occur post-cancer treatment, and of course also has its own impacts on quality of life and function. It can occur following any sort of impairment to the lymphatic system. So when it comes to secondary lymphedema, like we see with cancer treatment, this might happen because of a surgery. So for example, lymph nodes being removed or radiation in that area that's impairing the lymphatic system. So it's not able to absorb fluid as well as it could before. So just as an example, as you can see on the right, there's a diagram of our lymphatic systems. The little lines are the vessels, and the little bean-like structures are lymph nodes, and this is where viruses and bacteria are actually broken down in the body as well. If you take the example of breast cancer, quite often there's lymph nodes that might be removed from the armpits, which is kind of circled there. Or there might be radiation in this area that makes the lymphatic system less efficient than before. Because there's just less infrastructure there to absorb fluid, we tend to get a buildup of fluid in certain areas. So for example, the hand, arm, trunk, breast, and back area just prefer to flow into the armpit. So if there's not as much there to absorb the fluid, not as many places for the fluid to go, then we might get a backlog of fluid in one or more of these areas. Why is there this higher risk of cellulitis in lymphedema? So as I mentioned, there's often lymph node removal with cancer treatments, but lymph nodes are these amazing structures that protect us from viruses and bacteria. So if we take these out, we just have less immunity in that specific area of the body where the lymph system is draining to that area. Lymphedema can also reduce skin integrity, and we'll be talking about skin care and the importance of it later on. But sometimes with lymphedema, the skin becomes more stretched and thinner, so more vulnerable to cuts and scrapes or disruptions. Or sometimes it can become more cracked and creviced. And when we get these cracks and crevices, the bacteria might actually accumulate inside of them. So this increases the risk. And as we mentioned, bacteria just naturally grows on our skin. This is a normal thing. But if our skin is more prone to breaks or cuts from these changes, then it's just more likely for the bacteria to get into the skin and accessing an already kind of compromised immune system. And of course, that area of the body has reduced defense. So this just makes cellulitis more likely. And unfortunately, lymphedema swelling tends to be higher in protein as well, and protein can sometimes serve to attract more bacteria. And why is it important for us to talk about cellulitis today? Depending on what study you look at, there's some recent ones showing that 22 to 37% of patients with lymphedema may get cellulitis. I'm not sharing this percentage to scare you. Honestly, if you have education about what cellulitis is and how to prevent it, I would argue your percentage is much, much, much smaller. And of course, the literature shows that hospitalization from cellulitis is often quite preventable. It's just a matter of knowing how to reduce your risk. And recurrent cellulitis, unfortunately, can start a bit of a vicious cycle. So if you've had one cellulitis infection, and especially if it might have taken a while to get on antibiotics, there's a risk that that infection might have further impaired the lymphatic system. And of course, more impairment to the lymphatics means that your swelling might increase even more. When our limb is more swollen, it's more difficult to move around. Sometimes we're less likely to be moving that limb. And we know very well that exercise is a great treatment for lymphedema. So not moving that limb can actually increase our swelling further. The more swelling, the more likely it is to get a cellulitis reinfection, and the cycle kind of continues. So that's why it's ideal to kind of stop this cycle before it even gets a chance to start. When it comes to the literature on cellulitis recurrence, about half or 47% of people who've had one cellulitis infection tend to have another one within 3 years. Some people, unfortunately, suffer multiple reinfections, but I'm going to talk again about recurrent cellulitis near the end and kind of how to reduce that risk. And of course, there can be a significant disruption to daily activities with these reinfections, or even just fear of another infection coming. Importantly, signs and symptoms, what to look out for. So many people I talk to know to look out for redness, or if that redness is rapidly spreading. One thing I'll mention is for some people, for lymphedema, redness is kind of a normal side effect of their lymphedema. So if redness is there and normal for you and a physician has cleared that's not an infection, redness might not be your best indicator of when an infection does occur. And that's why it's important to know what these other symptoms are. So I made an acronym for you to help to remember. The acronym is SWEPT. That stands for swollen area, or that area might become more swollen than before. Warmth, so for example, your lymphedema arm might feel hotter than your non-affected arm when you're touching it. The edges of the discoloration might be sharply demarcated. It may be painful, and it might be tender. And the difference is with pain, it's kind of painful all the time. With tenderness, it hurts when you're moving that limb or when you're touching it. And just a really important note when it comes to color, especially since redness is the symptom we talk about the most, this is not true for all skin tones. So for darker skin tones, it might not present as red. It might be a slightly darker shade of skin. It might be more of a gray or a purple color. Or for some people, there might be no color change at all, in which case it's more important to look out for these other symptoms that we just talked about. And it's good to be aware of rare symptoms. So for example, flu-like symptoms like fever or sore stomach. I have a couple patients where this was the first thing that tipped them off because their limb was already just normally a little bit red, so they didn't notice at first. There can be red streaks, often moving towards the direction of the heart. Regional lymph nodes might be tender when they're touched, and this means the lymph nodes that are closest to that area, or blistering in rare circumstances might occur. If you suspect that you have cellulitis, so if you get any of these symptoms, it's really, really important to seek same-day medical attention immediately. Quite often, the quicker you're on antibiotics, the better things go, the less likely there is for there to be any sort of permanent impairment to the lymphatic system. Potential options for where to go is your family doctor, if possible, oncologist, a walk-in clinic, if really, really necessary, the emergency department. And it's good to note that some emergency departments now have virtual emergency departments if going in person is just not an option for you. I don't know about the other hospital networks, but at UHN, or University Health Network, where I work, Toronto General has a virtual emergency department that you can find just by Googling Toronto General Virtual Emergency Department. And they do treat skin conditions like cellulitis. They would assess you over the camera, and they can actually send antibiotics to your pharmacy that's close to you as well. In terms of prevention, which is the most important part of this webinar, it's good to note that studies, or a very recent study that came out that had over 2,000 participants, noticed that of the participants, patients with well-controlled lymphedema had almost half the risk of cellulitis as just the normal patients or patients without lymphedema that's well-controlled. And the expert consensus is really that early education is key. So learning, doing what you can, like attending this webinar, to learn about cellulitis risks and symptoms. My computer's trying to restart, so I'm just going to snooze that. Of course, seeking medical attention right away if you do suspect, or you do suspect cellulitis or you see any symptoms. And getting this education as early on in your kind of lymphedema pathway as possible. Just a reminder for who can help you for lymphedema management. This is a bit outside of the scope of the presentation, but I just wanted to add this quickly. speaking to your oncologist or physiatrist. Physiatrist is a specialist of medical rehab, medical and physical rehab, and we have a few that are cancer specific in our program. If there is a lymphedema program through your hospital, that's great to ask to be connected with them. Physios and occupational therapists with cancer-related experience are helpful. And there's also community lymphedema therapists, or what's called combined decongestive therapists. This is a training I also have, which is 135 hours of post-grad training in lymphedema specifically. This is pay out of pocket, but most private insurance do cover. If you want to find someone in your area, you can look up the Lymphedema Association of Ontario therapist directory to see people that are close by. And of course, community compression garment fitters. So the people that do measurements to help you get fit for lymphedema compression garments. And these are all people that are able to help for you to manage your lymphedema well. In terms of our general compression strategies, I have 6 here, and I'm going to go through each one in turn, but a big one is compression. I do want to mention that this evidence behind compression is specifically for people with lymphedema. So if you do not currently have a lymphedema diagnosis, then these studies don't necessarily apply to you. And I do want to mention that the evidence is primarily for leg and arm lymphedema. For head and neck lymphedema, there aren't studies out there showing that compression is helpful, and often for head and neck swelling, there's other strategies that can be sometimes even more helpful than compression, and compression isn't needed for everyone. So if you have head and neck swelling, I just don't want you to panic if you're not using compression. This is more so for our leg and arm folks. But there are some really great recent studies showing that compression for lymphedema, so for example, sleeves, gloves, stockings, reduces the risk of cellulitis and reduces the risk of cellulitis recurring. And it's best to start this as early as possible. So stage 0 is subclinical, where you can't even really see the swelling, or stage 1. And there's different options for compression, which is good to know and good to talk about with your lymphedema therapist. Bandaging, for example, can actually reduce the limb size and soften skin. If bandaging is not for you, there's also bandaging alternatives that you can talk to with a community fitter. These are things like reduction kits, garments that fasten through Velcro, for example. And some compression is better than none at all. So the ideal, typically, as long as that compression is comfortable and not harmful to you, is to wear it elastic compression during the full day. But this isn't necessarily possible for everybody. So if you can't tolerate all day, you start with what you can tolerate and slowly build up gradually. A lymphedema therapist or an occupational therapist or physio can often help with this. Or just know that there's other compression options out there. So talking to your fitter about a different fabric type, talking about a different compression grade as well. As long as it's comfy and well fitted, some compression is better than none. So too often I see that people feel guilty that they can't wear the compression all day, so they completely give up on it. But there's always some compromising and some in between there. This is just highlighting a study that looked at people with lower extremity lymphedema who had had at least one episode of cellulitis already. Half of the group got compression, half of them didn't. And they found that only 14% of people who were using compression got cellulitis versus 40% of the control developed cellulitis. And again, these are people that were already at higher risk because they had had one infection already. Also of the compression group, of those that did get cellulitis, only half of them needed to be hospitalized only half need to be hospitalized compared to the amount that need to be hospitalized for the non-compression group. So it basically reduced that chance of hospitalization by 50%. This group also did an interesting study on cost saving for compression with cellulitis. I won't get too much into the study, and it is Australia based, just as a note. But they found that of the patients using compression, this This equated to about a $21,000 savings over the year, and this includes both patient savings and healthcare savings, which is pretty big. Next, I'm going to talk about hygiene habits. So if you are using an elastic compression garment, wonderful. But really important to also make sure you're washing that daily. That's typically why you get two, so that when one is drying, you can wear the other one. But basically, bacteria and sweat can really build up in these garments, so we want to keep them clean. And the garments tend to lose their elasticity over time, but daily washing helps to keep that nice and tight to bounce that back. If you are bandaging, making sure to wash the bandaging equipment frequently, and the things that you can't wash, make sure that you're disposing of those often. Protecting your skin. So your skin is the biggest organ you have in your body, and it's this amazing thing that protects you from the outside world. It protects you from bacteria and viruses that could get in. And that's why it's really important to check your affected area daily. So for example, if it's your arm, checking between the finger webs as well. If it's your leg, between the toe webs too. Making sure to check between skin folds. So for example, for breast cancer, checking underneath the breast as well. Just checking for any cuts or abrasions. If you do notice one, you don't need to panic. Just make sure that you're cleaning that right away. Really simple, using a mild soap and warm water is great, and protecting that with a bandage and just monitoring for any signs of infections. Generally, we recommend avoiding manicures or pedicures, because there is a higher risk of infection with those. But if it's something that you really, really love doing, what some patients have done is they bring their own sanitized tools in for that, to reduce their infection risk. If you do have wounds, or for example, chronic wounds, and you're using compression, just make sure that you're protecting those before you're taking your compression garments on and off. Otherwise, taking them on and off can cause chafing or worsening of the wound. Moisturizing the skin is really important and often overlooked. I've had a lot of patients that tell me they were told they should, but they didn't really get why, so they just kind of haven't. But again, that moisturization keeps your skin nice and strong, so it's less likely for bacteria to get in that would cause that infection. If you're using elastic compression garments, so the garments that you're pulling on and off, typically it's better to moisturize at night, just because if you moisturize right before you put on the garment, it's kind of hard to put on. If you're bandaging, the reverse is true. You actually want to moisturize before you bandage. Generally, I recommend that people just use whichever moisturizer that they find works for them, that they enjoy using. For general rules, it is best to use unscented if possible, because fragrances can actually be quite drying. We did speak to a dermatologist who specializes in lymphedema, and they mentioned that if someone is using a moisturizer but still their skin is quite dry, they might consider switching from a lotion to a cream. Originally, I didn't know that there was a difference, but I guess lotions have higher water concentration, creams have higher oil ratio. So creams tend to be more moisturizing. Oils are the most moisturizing. So for example, coconut oil, olive oil, vitamin E oil. But the risk with these is that they might stain clothing. The nice thing about oils is they're less likely to cause any skin sensitivities. What the dermatologist recommended, if someone doesn't want to use just kind of full oil on themselves, is they can use their lotion or cream and then put a little dab of that oil, whether it's olive oil or coconut oil, and then apply that accordingly. That way you're not basting your whole limb in oil, just a little bit of added moisturization. And of course, I'm not a dermatologist. If you are kind of planning on switching skincare methods, do consult your doctor or dermatologist. If you tend to have sensitive skin, it's good to test that new moisturizer on your unaffected limb in a small area first, just to make sure you're not getting any sensitivities. Next is softening the skin. How is this different from moisturizing? So when I talk about skin softening, I'm referring to people who sometimes when you've had lymphedema for a while, the skin can get kind of firm or hard. And because 80% of our lymphatic system sits just underneath the skin, if that skin is really dense, the lymph just doesn't circulate as well. So there are strategies for softening that. If you're working with a lymphedema therapist, they can teach you self-massage strategies if safe for you, which you can do regularly. There's also nighttime garments you could talk to your fitter about. These are often made of channeled foam, and if worn overnight can help to soften that area over time. If it's density in the breast, for example, sometimes we use foam chip pads. We make kind of ad hoc ones here in clinic, but there are different brands that sell them, like Swell Spots, for example, which you can kind of insert into the bra where that dense area is and would help to soften it. There's also ones that you can use for different parts of the body. For example, if you have a lot of density in the hand, sometimes you can get a compression glove with a little pocket where you can insert a foam chip pad, and you can talk to your fitter about that as well. Behavioral strategies. So I do get a lot of people telling me, I know I need to moisturize, I just don't, I'm just not thinking of it. So that's totally fair. There's a lot going on to think about. But there's strategies we can use to increase our likelihood of doing it regularly. So if you have a backpack or purse you always bring everywhere, try to bring a little hand moisturizer in the bag. Especially with how much we're sanitizing our hands lately, it's really easy for them to get dry. Placing reminders, for example, recurring reminders on your phone. If you're one of these people, get out your phone right now, just put a daily reminder for moisturizing. Sticky notes also work great if it's somewhere that you look at a lot. So for example, your bathroom mirror or your fridge, or just placing the moisturizer right on the counter of your bathroom or right by the sink in your kitchen, or whichever sink you tend to use the most. Also consider bringing a travel skincare kit for when you go away. And this could be, for example, for a cottage weekend or a longer vacation. But this should have moisturizer, disinfectant, bandages, so like Band-Aids or larger. It can have bug spray as well to help protect the skin, and sunscreen depending on the climate and the season. And prophylactic antibiotics. If you don't know what those are, you probably haven't been prescribed them, so don't worry about the prophylactic antibiotics, but I will talk about them a little bit more at the end if you're curious what they are. It's also good to consider how your profession and your hobbies can impact your risk. So for example, if you're working in construction and you have lower leg lymphedema, or lower extremity lymphedema, I should say, there might be a higher risk of you getting blisters on your feet or you getting a cut. So just making sure that you're wearing the right protective equipment, like hard boots, to make sure that you're staying protected. If you're a gardener, that's wonderful, but there is, again, a higher risk that you could get a cut on the hands or kind of get dirt or bacteria on the hands. So just make sure you're wearing gloves. But just good to kind of reflect on what you do daily and little things that you might be able to do to reduce risk. I'm going to talk about now what to do if you do get an infection. So this is within the first 24 to 48 hours. Here, I'm assuming that you've already been seen by a doctor and prescribed antibiotics. Although regardless of if you have or not, it is good if you're getting discoloration on the skin to draw a line around the area of discoloration and write the date and time. That way we can track how quickly that's spreading or notice if it even is spreading at all. But otherwise, once you've been prescribed your antibiotics, you're back at home, you do want to keep monitoring that, kind of how much that might spread or reduce beyond the line. If that's not improving while you're on antibiotics within the first 24 to 48 hours, you definitely want to contact your prescribing physician. They might need to try a different type of antibiotic, for example. But otherwise, resting that limb in a comfortable position, ideally at the same level of the heart, and also making sure that you're drinking lots of water. If you do have a wound, for example, just coincidentally, or a chronic wound on that area, you want to make sure that you're getting proper wound care. And often your provider can make a referral for home care for wound care as well. When that wound is there, there's just more opportunity for bacteria to get in. So we want to make sure that we're treating that. Typically, your physician will encourage you to complete the full course of antibiotics. And if you have pain, typically what they prescribe is acetaminophen or Tylenol for pain. I'm going to talk now about what kind of your lymphedema therapist will consider for when compression will be okay for you again after your cellulitis infection. So before resuming compression, we want to make sure those antibiotics are taking effect so that that infection is clearly diminishing. It's important to take note of if the skin is still intact. So for example, if there was blistering from the cellulitis, or if there are cuts, we might need to wait for those to heal so that we're not chafing the blisters, taking that compression on and off. It's really important to know if you can tolerate it. It's normal for the limb to be a bit more painful after cellulitis. And we don't want to be putting on that compression if it's causing pain. So we might need to think of alternative forms of compression if that's the case. And it's also really normal for the limb to get a little bit bigger if you've had cellulitis. So your same elastic compression garment might not fit like before if it's too tight. If it's digging in, that could cause a tourniquet effect, which we don't want. So that might mean to hold off until you can kind of get a new garment that's better fit for you. If that compression garment that you currently have is too painful, things that your lymphedema therapist and fitters will consider, things you can encourage them to consider as well, is maybe going down a compression grade, choosing a different fabric or something that's a bit softer. If it's just harder to get that garment on after cellulitis, you can consider donning aids. These are aids that can help you with taking the garment on and off, things like Easy Glide or things like rubber gloves. Inelastic compression is compression that is put on with Velcro. So sometimes people find that easier than pulling elastic compression on and off, although it is bulkier, so that's something to consider. Lighter bandaging can sometimes also be an option for people that can't tolerate anything else or non-medical grade compression. So lastly, and I've been whizzing through this, so hopefully I haven't been going too fast, but I want to talk about considerations for recurrent cellulitis. So this is when you've had not just one infection, but you've had a reinfection, maybe multiples. It is normal in this circumstance sometimes for that discoloration or that redness to persist beyond the infection. And that can sometimes make it difficult to know if the infection has come back. So if this is the case for you, I encourage people to take a picture of what that looks like kind of at baseline with its new normal, its new color. That way, if one day you're like, is that looking like there's been a color change, like that's spreading, like that's a deeper red or deeper purple, you can kind of compare with the picture. And it might be good to ask your healthcare provider for a dermatologist referral, for example, especially if you're someone that's prone to skin sensitivities like rashes, or if you just can't get your skin well moisturized, it's constantly dry. Good to see a dermatologist. A chiropodist is a good idea for anyone with lower extremity lymphedema. These are specialists in foot care. If there's anything like warts or athlete's foot, this is an opportunity for bacteria to get in, and it's a higher risk of reinfection. So you definitely want to make sure that those are treated. And lastly, if you've had more than one infection, you could ask for a referral to an infectious disease specialist. I'm just going to end by talking a little bit about what infectious disease specialists are and how they can help. So these are physicians that are focused on diagnosis and treatment of diseases caused by bacteria and viruses. And typically what they do is they'll do an analysis of your healthcare history, and they might determine if there's other underlying causes that are causing even more likelihood of reinfection beyond just your lymphedema, and they can help to treat those conditions. They might prescribe prophylactic antibiotics, which I mentioned before. These are antibiotics that you can carry with you, so you have them at all times. That way, when you notice any signs of reinfection, you can start to take those right away. As I mentioned before, the sooner you're taking antibiotics, the less likely it is for you to get permanent impairment of the lymphatic system. So that can be beneficial. Even though you can start taking them right away, you still need to make an appointment to see the infectious disease specialist or your doctor as well. But it's good to eliminate that kind of waiting time to wait for the prescription and then get the antibiotics. In some cases, they might prescribe chronic suppressive therapy, which is where you take a very low dose of antibiotic regularly just to reduce your chance of infection. And they can also help consult on skincare and compression recommendations. So in conclusion, primarily I want to empower you that you can reduce your risk of cellulitis. And this is primarily through monitoring and protecting your skin, moisturizing daily, using compression if that's been indicated and recommended for you, being aware that if compression isn't working for you, there's other options, and just being very aware of how cellulitis presents and what the symptoms are. And of course, seeking medical attention immediately if you do suspect it for yourself. And that's everything for today. Any questions?